all about gene therapy. We will talk about the following topics. 1. What is gene therapy? 2. Gene therapy and cell therapy. 3. Role of viruses. 4. Risks and characteristics of diseases associated with gene therapy. 5. The future of gene therapy. 1. What is gene therapy? Genetic defects and some acquired diseases may be corrected or prevented by a technique known as gene therapy. This involves inserting a gene into a patient's cell who may have a disease problem. This novel approach in the prevention or treatment of genetic disorders and acquired diseases may soon replace drugs or surgery. While gene therapy uses genes to be transferred into cells in order to improve or even cure a disease, cell therapy uses cells. Fetal stem cell is preferred over an adult stem cell. Fetal stem cells have the ability to divide and self-renew as well as provide cells that mature into the relevant specialized cells of the tissue. However, the use of adult stem cell is not uncommon. What are gene therapy and cell therapy?
Great question, Ross. Gene therapy uses genes in the treatment of prevention of genetic defects, including mutation and some acquired disease. Genes may be introduced, removed, or changed in the cells of patients receiving gene therapy. This mostly experimental technique changes how the cell produces proteins.
How does gene therapy work?
Great question, Ross. In order to deliver the genes into the nucleus of the host cell, a vector is needed. If genes are directly introduced in the cell may not be viruses are normally used as vectors, where they are injected intravenously or injected to specific tissues where the problem is occurring. The vector then infects the surrounding cells in the tissue, effectively delivering the genes vectored by the viruses.
What are the strategies being used in gene therapy?
Great question again. Presently, there are a number of strategies that are mainly used in somatic cells, such as gene addition, gene correction, gene silencing, reprogramming, and cell elimination.
What are the uses of gene therapy?
Great question again. Replacing missing or defective genes. Deliver genes that speed up to the destruction of cancer cells and supply genes that cause cancer cells to revert back to normal cells, and deliver bacterial or viral genes as a form of vaccination. Provide genes that promote or impede the growth of new tissue, and deliver genes that stimulate the healing of damaged tissue.
What are the common types of cell therapy?
Eighth question was another common cell therapy is the transplantation of hematopoietic stem cells to create bone marrow, which has been performed for over 40 years.
Role of viruses. How are viruses used in gene therapy?
Thank you for that wonderful question, Rose. These viruses are engineered such that they replicate only or predominantly in cancer cells, causing the cancer cells to lie. The released viruses during the cell slice will now infect other cancerous cells but not normal cells. These types of viruses are known as oncolytic.
Can viral vectors make you sick?
Thank you for that wonderful question, Rose. No, because these viruses used in gene therapy are designed to reduce the risk of adverse effects. These viral vectors are tested in animals and human trials to make sure that human cells are not harmed. However, like all treatment or therapy, it has its risk. Therefore, anyone availing of this therapy must discuss with their physician and other health advocates the pros and cons of gene therapy.
Risks and characteristics of diseases.
Yes, Ross. Risk associated with gene therapy. Risk of any medical treatment depends on the exact composition of the therapeutic agent and its route of administration. Different types of administration, whether intravenous, intradermal, or surgical, have inherent risk. Risk includes the outcome that gene therapy or cell therapy will not be as effective as expected, possibly prolonging or worsening symptoms, or complicating the condition with adverse effect of the therapy.
The future of gene therapy.
So, since DNA is more stable and functions inside the cell, the delivery of genes may result in longer term expression of necessary proteins. Because of its accuracy, gene therapy has the potential to eliminate cancer cells without damaging normal healthy tissue.